We show philosophy and photography of a profession with the courage of nurses during the COVID-19 pandemic. Okay, as we know, the coronavirus pandemic has affected the whole world since the beginning of the last years. The spread of SARS-CoV-2 was announced on January 9, 2020. And following the speed and size of the infection, the World Health Organization declared on the 11th March 2020 that this infection was considered a pandemic. As nurses, it interested us directly, and we wanted to study the response of health workers to the pandemic, who continued to guarantee the necessary existence despite the danger of the virus. And we, for our purpose, we have consulted various databases, both for the evaluation of the Italian situation and the global situation. For Italy, we consulted the Italian Institute of Statistics, Ministry of Health website, and the Nursing Professional Federation. For the world situation, we consulted Amnesty International, European and General Center for Disease Control and Prevention. And we also consulted the website of World Health Organization. And for to better identify the concept of courage, we consulted texts on philosophy, and we researched also online studies published in scientific journals to assess the impact of this pandemic on healthcare workers and nurses, the most invested professional category along with doctors. The virus has affected 229 countries, causing more than 109 million cases. Almost 230,000 cases are health workers, has caused more than 2 million deaths in the world, and at least 7,000 deaths involving health workers. The countries with the most number of deaths among health workers are Mexico, United States of America, Brazil, Russia, India, South Africa, Italy, and 47% of the total infection among health workers are nurses, the people closest to the people affected by the virus. The International Council of Nurses confirms that more 1,500 nurses have died from COVID-19 in just 44 countries, and estimates that COVID-19 health workers that's worldwide could be more than 20,000. What are the effects of COVID-19 on nurses? Among the greatest effects of the virus on nurses, they say they have tried uncertainty and fear that has been shared as a distinctive element of the pandemic experience and has been manifested by nurses almost to the point of upsetting him since the early days of the infection. Nurses also claim a disorientation never felt before that was accompanied by fear of the unknown. All this is also due to the fact that the pandemic was perceived as something distant that would not directly affect their reality. This thought underlines a lack of awareness of pandemic situations. Also present was the perception of being overwhelmed and not knowing what to do, with a sudden and truly violent first impact. The lack of information about the virus and the ability to care for patients has also resulted in a declared sense of inadequacy and helplessness. The virus also entailed the need to change practice and mentality in a completely different way, with the need to learn on the ground day by day, with mistakes and their consequences, such as a guilty sensation. leading to a climate of uncertainty and to worries about one's contagion, to possibility of infecting one's family members, and some narcissists decide voluntarily to live in isolation and away from their families, with the presence of sudden cry fits, a feeling of pain. Everyone thought that this could not happen to us. Also, for this reason, there was a lack of preparation. The virus has also caused an alteration in the perception of time and space. It is now possible to divide one's experience in lives into a time before and a time after the virus. The passage of time has become dilated, as if the perception of time were suspended. The prospects for the future are uncertain. There is a feeling of being locked in a bubble. The space and times of treatment were characterized by exhausting shifts and complex procedures for putting on and taking off personal protective equipment, such as a mask, double pairs of gloves, and more. The narcissist experienced severe physical fatigue and heavy professional experience with thirst, hunger, and a loss of lucidity. By consulting databases such as PubMed or Cochrane, we have found studies conducted in many countries. In Spain, an online survey on 1,400 healthcare workers showing how emotional exhaustion and depersonalization, altered perception of oneself and the environment, contribute to psychological distress, while resilience and fulfillment may be a protective factors, with the symptoms of post-traumatic stress disorder in 56% of respondents. An American web survey involving 657 doctors and nurses reported that nearly 60% of respondents say they had psychological distress, 47% showed depressive symptoms, more than 30% had an episode of anxiety. An Italian cross-sectional study that investigated symptoms in healthcare workers, which included 1,379 people, showed that 50% of respondents say they had post-traumatic stress disorder, 25% severe depression, and 8% anxiety, 20% insomnia, 22% experience high stress level. Another systematic review, which included 117 studies with more than 119,000 healthcare workers, showed that 40% of respondents say they experienced severe acute stress, 30% anxiety, 28% burnout, 13% post-traumatic stress disorder. Another review conducted in China showed that one of 33,000 health workers, 39% had sleep disturbances and 22% felt depressed. A follow-up study in Mexico of 200 healthcare professionals confirmed that resilience plays a protective influence. Persistent burnout can contribute to symptoms of depersonalization and acute stress. COVID-19 put everyone face to face with the inevitability of death, and anyone could be infected and have serious consequences. Death experienced in absolutely loneliness, too many deaths with no way to communicate with relatives or with the people important to people who are dying. There was only narcissism. Advocacy as guarantor is the way for patients' isolation. Narcissists become the family for patients and suffered with them. But none of them stopped in taking care. Thanks to the pandemic experience, the operators were able to build teams with solid relationships. The pandemic highlighted the importance of nursing in caring. The pandemic has forced health workers to give strong responses, leading to change management. We have seen important changes in roles and relationship in organizational and professional structures. The change was also perceived as a change in the image of the nursing profession, with perceived a change in their role within the organization as essential for the success of the treatment and in the relationship with other professionals. The media, citizens, and the organization have begun to recognize the importance, uniqueness, and courage of nurses. Working in the hard time of the pandemic has led to an increased spirit of cohesion and mutual solidarity. Valuable care work with an unthinkable profile in the past. Nurses are the resource we feel closest to in recovering and maintaining health, always, in time of pandemics or not. Nurses live the spirit of service and a professional identity that distanced itself from the idea of a hero. Each professional felt part of a group sharing a common language, codes, and goal in a respectful climate. Nurses found support and comfort in their professional group, helping each other. The family became the colleagues. And nurses showed a lot of courage, the courage that Plato claimed to be a virtue and consists in not abandoning the battlefield, fighting in its place. While Aristotle considered courage as being afraid of certain fearsome things, but to face them even if we could avoid facing them. And nurses did it. They stayed in the field, facing their fears. Nurses have no lack of courage, proving they are there, leaving no one alone in 2020, the International Year of Nurses. Nurses do what no one else will do in a way that no one else can do, in spite of all that one can think of. This is the essence of a nurses. And the courage calls for a moral capacity for action, and nurses work collectively to become a moral community and to propose alternative, strong, ethical, and intelligent narrative of our work. I think that we can proudly say that life begins where fear ends and nothing can stop nurses. And we have to be proud to be a nurses.